everybody, Azar, I'm back, Doctor of Physical Therapy. Today I promised that we're going to talk about the lower extremity deformities. We started with that scoliosis because we started with actually hip unevenness. And one of the things that can happen with the hip unevenness can be a scoliosis. Could be going either way, the scoliosis causing it or this one's causing the scoliosis, which I'm going to show you how now. So if it's not a scoliosis, though, it could be true leg-leg discrepancy. If it's a true leg-leg discrepancy, then we have unevenness in the actual length of lower extremity. So why? Nobody knows. The growth plate in one side versus the other side, they just decided to work more and grow a little bit more. So, I mean, people are unique, right? They born with a different kind of small deformities, and they just have to know and take care of it and don't let it get worse throughout their life. So minor deformities are fine. Everybody have them. So if it's from a scoliosis, we already talked about it, and I can just very, very briefly talk about it again. So if it's from the scoliosis, imagine if you have this, like one side of the spine like that, so you're gonna have this a little higher, right? A little bit. So not gonna be too much though, but it's gonna happen. So if it's from the true leg-leg discrepancy though, it can cause a scoliosis, and I'm gonna show you how now. If it's a true leg-leg discrepancy, so you're gonna have the actual length of your lower extremity different than the other side. So how you measure this? You wanna have the patients stand or lay down, doesn't matter, because standing and laying down both having the same measurement in both lower extremities, because they don't have any other part of the body involved. So we're gonna go ahead and put the tape measure in here in the ASIS, and then I'm gonna put the tape measure in the other side of the malleolus, so medial malleolus, another bony prominent. And then we measure those versus this, and if the difference from this side and the other side is more than 2 centimeters and 2.5, which is an inch, then it's called significant. If it's less than that, it's probably insignificant, but it still can cause the issue. So if you see that leg-leg discrepancy, especially true leg-leg discrepancy on the patient or in the kid, you have to be worried about the hip growth plate will be having some problems, which did not let that leg grow as the other side. It could be even the knee growth plate and ankle growth plate, but it's usually more common in the hip. So the only thing that I wanted to tell you on that is how to do the quick fix, even though if it's a scoliotic one or non-scoliotic one, doesn't really matter. Sometimes it could be both. Patient have a scoliosis and also have the true leg-leg discrepancy. So anyways, we can fix it with very simple ways. So fixing means that we don't care if patient laying down and they have a difference in the length. That's just cosmetic. We don't care as a physical therapist because it's not going to cause a functional damage or problems later. What kind of problems? Yeah, it can be like wearing and tearing in one side because it's constantly putting pressure, weakness on the opposite side because all of the body weight goes in one side and the other side doesn't get any body weight. The muscles start shrinking on the other side, and then the other side can be more prone to the injury if they start using that side now. And the side that they are using, it's overuse injuries and all kind of cartilage damages faster and all of this. So we don't want the right and left of the body to be uneven, period. And we are uneven because we created with the one side dominant. That's how we created, and we can't do anything about it. Some of us are gifted to be ambidextrous, be able to use both hands for riding and everything, or both legs for kicking the ball, but most of us, we are one side dominant. So one side is definitely stronger than the other side anyways. So that way we can know that we're gonna have to have these problems in everybody. But if it's more than certain amount, if you see one leg is shrunk and one leg is really big and grown, that's one indication of your kid that, oh, that my kid might have a leg-leg discrepancy. I never checked. My kid might have one leg longer than the other one. So imagine if I have the one leg longer than the other one, which in mine is a little bit higher than this, but is more from scoliosis anyways. But we're gonna have more body weight on this side while they're walking. So what happens is this other leg starts shrinking, started not getting any opportunity to weight bearing and getting weaker and weaker and more prone to the injury. and this side gets overdeveloped, and you can get like all kind of nerve damage later on here, arthritis faster, wear and tear damage, and all kind of stuff. So basically, we want to make sure that they both are even as much as possible, okay? So what we can do in that case, if we see that unevenness and we can observe that, oh, my kid has like, it looks like it's one side is more grown and is like a little bit more than what normally it should be for dominant leg, okay, that should like click and then give you like a heads up that you should take the kid to the orthopedist, or you should, first thing you can probably just check the leg discrepancy again by putting your hand here and there and putting a tape measure. Okay, so how if we find out that our kid has that? So we definitely have a lot to offer for that leg discrepancy, but the first thing is we try to make it even when they're standing. Again, because we don't care about laying down. When they're standing, they put in body weight, they have to be like even, not to wear and tear one side. So what we're gonna do, we're gonna use the insert on the shoes. I'm gonna show you on my shoe, okay? I brought my shoes for you. Oh, it's a little dirty, but that's okay. So, and I put 2 inserts on this shoe. I'm going to show you these 2 inserts. They are regular ones, not fancy or anything, okay? I put 2 inserts on this one, which is my left side, right? My left shoe. Why on my left side? And nothing on the right. No inserts on the right. Why is that? Because I have this side higher. And if I put insert in this one, I'm going to get higher, one higher and more crooked. So I'm going to put 2 insert on that, no insert on this. So now I want you to compare me before and after. Okay? This is the area that I have my ASIS right now. I'm not sure if you can really follow that. Try to follow. This is going to be a lot higher than my finger before that. And when I'm putting my shoes on now, I want you to look at it again. I'm putting my shoes on. Now you look at me. Should be pretty much even, hopefully, because I have 2 inserts on this side, so this side came higher, so which is good. It kind of solved the problem. I already feel that I have to take more body weight on this side, which I didn't feel it before. I felt that I have to put my body weight on this side, and I never knew that I'm not even putting any body weight on this side while I'm standing and walking. Now I do, because it's long enough, and I have to really put my body weight on this side too. That way I can make more muscles in this side, right? And make it stronger and resolve the problem and take the pressure off of this side. People usually get back pain on the side that's longer, because, or sacroiliac issue on the side that's longer, because it's a lot of wear and tear on the cartilage. Okay, that's it for this one. I just wanted to show you that deformity, long leg discrepancy, and one leg discrepancy, and longer leg and shorter leg, what kind of injury they can have. So that's very simple. You should look at your kids, and then if you feel the unevenness between the muscles, like one muscle is a little bigger, the other muscle looks shrunk, or another indication, which is very interesting to know. When the kid's standing like that, okay, the side that's longer, what happens to this? The side that's longer usually gets a little bit bend the knee. If it's very severe, this kid doesn't want to make that knee straight, because if it make it straight, it make it more and more higher. So what it does to compensate, it brings this knee when they're standing a little bit bend to make it even. Look at me again. When I'm going like that, you see the difference versus when I'm going like this. Okay, I resolved the problem, right? It looks like I resolved the problem, but that's not a good thing to do, because always having that knee bend and then this knee hyperextend is going to hurt the knee. So we have to make the correct things a little bit more deeper, not like that. But that's how you can look at your kids. If your kids like standing always like this and struggling to straighten this one, even hyperextend that knee, and then make this knee a little bit always semi-bend, then that's an indication of the kid having the leg discrepancy or unevenness on the leg length, okay? That's how you recognize leg discrepancy, and later on we're going to show you how to treat them, but today is just for diagnosis. I just want you to really look at your kids like a detector and then investigate your kid and then see all kind of deformity that the kid might have. Thank you for watching and have a great day.